I'm going to be doing a quick abdominal assessment on this patient. So this is Mr. Pillow. I'm going to first come in, I'm going to do hand hygiene, I'm going to put gloves on, and then I'm going to identify the patient by checking their name, their birthday, and their ID band. I'm going to close the door and pull any curtains to make sure the patient has as much privacy as they need. And then if the patient is wearing clothes, we're going to help them get out of it if they need it. In this case, he's already not wearing too much, so it's fine. I'm going to get the patient into a supine position and raise the bed up to a working level. In this case, my bed is on the floor and does not move up, so I'm kneeling. I'm going to expose the patient's torso, and in this pillow's case, I'm going to pretend these are legs, and I'm going to pretend this is the torso, and like the umbilicus will be around here. Let me just recover. So first thing I would do is get a history for the patient. I would ask if they have any like history of wounds, what their if they have a surgical history with their abdomen, if they've ever like if they experience constipation or diarrhea, what medications they take for that kind of stuff. I would ask when their last bowel movement was, when the last time they peed was, if they have normal pain there, or if it feels like tense or like is often distended or anything, just to get a good gauge of what they've been dealing with in the past and what's normal for them. I'm also going to be assessing it at the same time. So my visual assessment, I can look and see if there's any scars, I can see if there's any surgical incisions, I can see if the abdomen is symmetrical, I can see if it's distended or if it's like bloated, or if it is like if there's a hernia or something. I can visualize that stuff at the same time as getting the history. Then because auscultation will be disrupted by palpation and percussion, the next step here is going to be to listen. So I'm going to use alcohol wipes and make sure this is clean, and then I'm going to listen to the patient in all 4 quadrants for a minute in each quadrant. So starting, just exposing him a little bit so you can see better. Starting in the right lower quadrant of the patient, I'm going to listen for a full minute. I'm not going to actually do it in this video. And then I would note if that vowel sounds are active, hyperactive, diminished, and I would continue up and then across and then down, each for a minute. If I believe that there were no vowel sounds, I would have to listen to that quadrant for a full 5 minutes. Luckily, he is active in all quadrants, and I don't have to listen to 5 minutes for each quadrant. So I have now listened. The next thing I can do is to percuss. So that would be to see if I can see where the bowel movements are in the intestines and everything. And I'd be doing that by making a tapping motion against my own fingers to see if it's like hollow or if it's a dull sound. If it's a dull sound, it means that there's something there. So I would do that in the same order, right lower quadrant first, ending in the left lower quadrant. So so I would note whatever I found there, and then I would end with palpation. I would let the patient know that they should tell me if they're feeling any pain, and that's what we're really looking for here. And they should tell me if their pain is on me pushing or if the pain is on the release. So that was rebound tenderness. So I'd start in the right lower quadrant, and I'd push in about an inch. And if the patient had like a surgical wound or something, I would be cautious to not be as rough around that area. But that would be my abdominal assessment. I would document all of my findings to create a baseline or to acknowledge any problems that the patient already has. Other than that, I would get the patient into a comfortable position. I would lower the bed to the lowest position, make sure the bed rails are all up, and make sure the patient has a call bell near them, and that's really it. I'd do hand hygiene and go. Okay, cool.